Sound rolling.
Camera 1.
Rolling.
Camera 2. Rolling.
My name is Patricia O'Connor, and I'm currently semi-retired, but I still work as an advisor for University Research Company, which is a global public health focused company. And I've been with that company since 2014. I worked in the field as a program project director on 3 successive projects in community health and nutrition, tuberculosis, and HIV. And then I went to our headquarters near Washington, D.C. as a vice president, and now I am semi-retired, but I continue to serve as an advisor, and I support a lot of implementation science, which generates the data and evidence to allow us to improve program outcomes to ensure that they're equitable and inclusive of all the community members where we implement programs. I came to Tulane in 1979, fresh out of undergraduate school with a major in anthropology. And I was really excited about joining the Latin American Studies program because I wanted to expand a little bit more into the social sciences. And although Tulane didn't really offer a medical anthropology program, there was a strong School of Public Health, and so I had the sense that I might be able to do some crossover, and I stayed at Tulane for my master's degree, and I went on for my PhD and left in 1987. My affiliation with the Stone Center for Latin American Studies has just given me a platform for a life of exciting work overseas. And I had the opportunity to use my interdisciplinary understanding of Latin America to branch out into humanitarian assistance, peace-building work with the United Nations. So I always felt that the foundations I got in interdisciplinary understanding enabled me to transition between different roles and different focuses of programs in international development programming. If I have to choose one standout event during my time at Tulane, it would be the arrival of Dr. Carol Bearhorst in New Orleans. I had met him during my first year, my first summer research program as a Tulane graduate student, and we became very close, and he became an informal mentor for me, and I came to Guatemala many times to work with him and to support his program. But this was all unfolding in the 1980s when there was a lot of civil conflict in Guatemala, and several years after I had met him and was working with him, he was exiled from Guatemala and arrived in New Orleans on my doorstep. And the response of then director of the Center for Latin American Studies, Richard Greenleaf, and Dr. Bill Bertrand in the School of Public Health was phenomenal. So we worked, the 3 of us, together to help him find housing and to get an adjunct faculty appointment. And we worked together to develop a new series of courses in the School of Public Health. So he developed a very, very strong relationship with the Center for Latin American Studies and was a very generous, warm, inviting colleague at that time because we were sharing an office, but also just as a teacher at Tulane. To me, the legacy of the Stone Center on my professional career and development would be roots and wings. I felt that I got such a strong foundation in understanding Latin America from the interdisciplinary approach, and I had the confidence and really the skills and abilities to launch a career in international development. And I feel my career was a gift. I loved what I did. I loved the places my husband and I were able to travel to and work in. So yeah, I would say roots and wings is the legacy that the Stone Center gave me.
Thank you, Pat. That
You're
was beautiful.
welcome.